Thank you. And I think let's start.
Yes, sir. Please go on.
So in this group, I hope all of you are now familiar with the concept of palliative care. And what I gather that this is the last lecture of a series. And unfortunately, what happens is that somehow religiosity and spirituality tend to be pushed right to the last. Whereas you see, because when you're talking of death or when you're talking of suffering, when you're talking of something bad which is going to happen for a person who is going to die and who is aware of the fact that he's going to die very soon, issues, existential issues like religious issues or spiritual issues become very, very important. And these issues, actually religious issues or spiritual issues, can actually have a bearing in the overall quality of life of the patient. They do always have a bearing on the overall quality of life of the patient, right? Because you see, your mind, the mind of any person, that is what we need to control. Our happiness, our sorrows, everything is generated. Our fears, everything is generated from our mind. So what we need is some level of control of our mind, some level of mind control, or rather what we need is some level of quietening of our mind so that we come to terms with our suffering, so that we can make a sense of meaning out of our suffering. I'm sure in this audience, in this whatever little what I gather is there are currently around 24 participants. There would be none of you who has not undergone suffering. All of us have undergone suffering at some point of time or other. But what makes suffering worse is when that suffering is not given a sense of meaning or purpose. When we understand that our suffering has a reason, or when our mind understands that this suffering is because of these factors, or this suffering will lead to this further action, that is when we can come to terms with our suffering. And that is how we overcome our suffering, right? So suffering must be given a sense of meaning or purpose so that we can transcend our suffering. So the same thing would happen to a person who is dying. If you picturize yourself lying on a bed, waiting for death to finally come and take you, conquer you. So what happens is that you are catastrophizing. You keep on thinking how death would be, or how painful the whole experience can be. A very simple example is that most of you are vaccinated by now, the COVID vaccination, right? So most of you, when you have gone to take the vaccination, you would be thinking of the pain of the needle, of the pain of the injection. But actually what your mind is catastrophizing, what your mind is actually projecting the pain to be, when you actually take the injection, you feel that, no, I was just thinking in such bad terms. It's just a mild, thing. So that is catastrophizing. And that is when your mind, if you tame your mind, or if you train your mind and tell that, no, it's not going to be all that bad, that is when you make a sense of meaning out of your proposed suffering, right? You see, it's seldom a medical man has true religious views because there is too much pride of intellect. And this is George Eliot. And this statement you see is very much true in today's lecture itself. In this whole series, you see spirituality and religiosity has been pushed to the very end. Because you see, medical persons do not consider these things to be very important, in spite of the fact that I am a doctor, I'm a medical doctor, but I have learned the hard way, you see. I've learned the hard way, and I've learned from my patients. And I am now convinced that spirituality and religiosity are very, very important when you try to make a sense, when you try to make a sense of meaning and purpose out of your suffering. Illness is a spiritual event, right? So you are all aware of it. Remember when you were a little child and you used to fall sick, you used to have high fever and all, and your mother would take your head in her lap and gently, gently soothe you and run her fingers through your hair and sing a lullaby. And that used to be the best comfort. Even the best medication would not provide that level of comfort. But she didn't do anything very clever or scientific. You call it scientific. The scientific community will say, oh, that's just by fluke. No, it was not by fluke. It was because of her intention. That was her intention to provide a sense of comfort, compassion, and healing, not treating. It was healing, right? So illness is a spiritual event, and all of us who have fallen ill at some point of time or other would acknowledge the fact. The moment you fall ill, you start having different thought processes in your mind. And those thought processes are existential thought processes. You feel that, why am I suffering? Why has this illness happened to me? I haven't harmed anybody. So why me of all the people in the world, right? So, and that is when it raises troubling questions of a transcendental nature about the meaning. What is the meaning of life? Why am I alive? What is the value? Who is going to look after me? About values and relationships, right? So here in this photograph, this was a patient of mine, and you can see this is his son. He's actually giving a glass of water to his father, and this is his daughter-in-law. She's also, providing him some degree of comfort. But what is more important, if you focus on the background, you see photographs of family, extended family, and photographs of various religious figures, gods. And these become so important, these background becomes very important when you're faced with a life-threatening situation or any illness or any such catastrophic events in your life. Those things which are there in the background, they actually come to the forefront at that point of time. The physician's own belief system, whether spiritual, religious, or none, affects medical decision-making consciously or unconsciously. So again, as I said, that if your treating physician or does not have any belief in spiritual or religious issues, then you are going to have a tough time, believe me, right? And I was in the same boat around 15 years back. And 15 years back, then I made a conscious decision to step into the other boat of spirituality. And I learned the hard way. But the best thing is that I did learn, and that's what made the difference. You see, visible light covers only 2% of the electromagnetic spectrum. So what we are seeing now, we are seeing each other, we are seeing the screens. So this is because we see the visible light, but what we are seeing is only 2%. 98% of the visible light of the light is basically invisible, but that doesn't mean that it is not there. 98% of the light is still there, but it is invisible to the naked eye. With various special devices, we can visualize a higher percentage of that light. So although we see just 2% of the visible light, that does not mean that 98% is missing. 98% is also there. It's just that we can't see it. It is something akin to this image. And if you are familiar with Hinduism, and this image is a very old image. It's a Puranic, it's an image from the Purans, from the Vishnu Puran. This is one of the avatars of Vishnu, in which he is actually lifting the earth on his snout. So this image would be something like at least 3,000 or 4,000 years old. But then if you ask yourself, when exactly did the Western civilization discover that the earth was round? It was hardly 200 or 300 years back that the Western civilization discovered that the earth was round. But you see here, our ancestors were already aware of the fact that the earth was a globe. And this was almost 4,000, 5,000 years back. So we need to understand that just by science, just by the so-called modern ways of education, we cannot become educated. If you insist on believing that our ancestors were fools, then, well, that is your own choice. But you need to understand that, as I said, visible light covers only 2% of the electromagnetic spectrum, which does not mean that 98% is absent. 98% is still there. And as Rabbi Abraham Heschel said, it is a grievous mistake to keep a wall of separation between medicine and religion. Right? It's a grievous mistake. The act of healing is the highest form of imitatio Dei. Means the act of healing is just like the hand of God. So we need to be more like healers and not merely treaters. If you just use science, science is very dry. It lacks that emotion. It lacks that compassion. Science is a very dry subject. So if you want to be a doctor who is just focused on science, and if you just want to treat your patients with medications or surgery without focusing on the spiritual aspect of the whole care process, then you're going to do a grievous mistake. And I frequently in my talks, I show this beautiful slide. This was a little girl, as I said, she's no more now. And you can see this huge growth. There's a large tumor in her upper arm. And she used to come with her mother, to my clinic. And whenever she used to come, her head used to hang down like that. She never used to look up at me. And she never used to talk also. And we all used to think that, oh, maybe she is having a lot of pain and this and that. And we used to treat her with pain medications and everything. And one day I decided that, no, enough is enough. I have to communicate with this girl. And I spent half an hour. I sat with that little girl and I brought her a box of chocolates as well. And finally, half an hour later, she actually lifted her head and she looked up at me. And these were the most beautiful eyes that I've ever seen in my life. And then she started speaking to me. And you know what she told me? She said that when I watch my mother crying, when she looks at me, when my mother looks at me, she starts crying. And that is something which I don't like. And all these days, then I thought that I was thinking in terms of physical suffering of this girl. I thought that the girl was in distress because of her own physical pain, but no. What this little girl was more agonized with was the suffering of her mother, because she couldn't bear to see her mother crying for her. More than 80% of the population has religious faith. So more than 80% of the population, but somehow our scientific world doesn't believe in religion and spirituality and all those things. All religions believe that God or a superior force can intervene for the prevention and treatment of illness as a response to personal prayer, meditation, reading of sacred texts, or healing services. Some groups emphasize dependence on prayer, with advice not to take medical treatment also. So are we to infer that 80% of the population of the world are fools? Are we to infer? No, not at all. So we need to accept the fact that there are issues which are much beyond the realm of science. There are so many things which science cannot always explain. But those do happen, and those do promote healing as well. Now, what exactly is this religion? Religion is a structured belief system that addresses universal spiritual questions. Like we are all now, we have 40 participants in our group right now. And if this 40 participants, we get together and we decide, okay, now we will pray to this XYZ figure and we will call it God or whatever it is. And we will we are now forming a group, and these are our rules and regulations. So we form a religion now. So that is how religion was formed. Religion is always man-made. We make it. It is corporate, group-based, structured system, an organized system. So religion is something which is man-made. We make it. Whereas spirituality, what is spirituality? Spirituality is anything which gives you a sense of meaning or purpose in life. So anything which makes you want to keep living, anything which gives you a sense of meaning and purpose in life, that is spirituality. Like maybe you love your children. For you, your children is your spirituality. Someone loves their dog. Their pet gives them spirituality, a sense of spiritual this thing. Spirituality and religiosity do not mean the same thing. You can be spiritual. Everybody is spiritual, in fact. But not everybody is religious. You may believe in God, you might not believe in God. That's fine. But everybody is spiritual, because spiritual is something which is inbuilt. That is your inbuilt. Right? Religion is something which is added on to you, because that is man-made. But spirituality is within you. It is built in. So what is that? Spirituality is anything which gives you a sense of meaning and purpose to your life, to your existence. Spiritual issues often surface during end of life, because whenever you are faced with a threat to your own existence, then there will be very troubling questions. That why is this happening to me? What have I done? What wrong have I done? Right? That sort of various questions you can have. Those are spiritual questions. Here is an example. Now, this is an elderly gentleman, was an elderly gentleman with CA lung, and he had pain, but we treated his pain. But the problem was he would never be comfortable alone, right? This is his wife in this sari. And to the extent that he never wanted to be alone, whenever his wife used to go to the washroom, she had to leave the door open. This man was so scared. And this is his daughter. His daughter was married off. And he had a son also. And the son had a fight with his father, and the son was now living separately. Now this gentleman, he had this sense of fear. He had, so that he would not let his wife out of his sight. So gradually we came to know from him over a period of time the reason of his fear. He was a Hindu, and in Hinduism it is believed that if the son gives fire to his father's, if his son lights the fire of his father, then the father would go to heaven. This is a belief in Hinduism. So this man, when he was confronted with his own mortality, now he was terrified that, see, look, my son has fought with me and is living away. He's living far away. Now, if he doesn't come and light my pyre, what will happen to me after I die? I'll perhaps go to hell. So this was something which used to trouble him. So this was his religious pain. This was a source of his religious pain. Okay. So then we talked to his son, we negotiated with him, and finally the son and father, again, they were on talking terms, and then this man died happily about a month later. So issues like here, if I just give him some medications and suppose I give him extra doses of morphine or other sedatives and all to take away his fear, that fear will not go away then. That fear, because that fear was a religious fear, and that could only be alleviated by negotiations and something beyond something beyond medications. Now, what is the role of religion in palliative care? They serve two prime functions. First is to provide a set of core beliefs about life events, provision of a set of core beliefs about life events, and to establishment of an ethical foundation for clinical decision making, right? So many might believe that, say if it comes to dying in a hospital or dying at home, or how you really want to die, those can be influenced by your religious beliefs. Like Jehovah's Witness, they don't want a blood transfusion. Come what may, they would be refusing blood transfusions. So that's their religious belief, and those little beliefs need to be respected, right? So religion, what are the good things about religion? Religion helps to cope with stress. Studies have shown that 9 out of 10 hospitalized patients use religion to cope. Over 40% say it keeps them going. It acts as a buffer against depression and speeds recovery from emotional disturbances. It is associated with positive emotions and good quality of life, actually related to lower rates of alcoholism, drugs, crime, and actually gives better school grades. So it makes sense to tell your children to be religious because they would have good school grades. And these are backed up by scientific evidence in terms of statistical records. Religion is related to healthier lifestyles and fewer risky behaviors. So many good things about religion now, you see. Lower rates of hospitalization and long-term care, greater marital stability in religious persons compared to atheists, enhanced family relationships, more social support, because if you have a religious group, you tend to give social support to your own religious group. So more social support actually. And now the burning question, does religious attendance actually prolong survival? Yes. The beautiful study by Harold Koenig in gerontology in 1999, older adults particularly, this study was mainly done in a Christian-based society in the US, and older adults, particularly women who attended religious service at least once a week, appear to have a survival advantage over those attending less frequently, which basically means that if you are religious, you tend to survive for a longer period of time compared to atheists. Greater longevity, actually 7 to 10 years of additional life. 7 to 10 years of additional life, and that is not a joke, right? Now, religious coping. What is this religious coping? Now, suppose you are faced with a terminal illness or any catastrophic event in your life. So how does religion help you to cope? Efforts to understand and deal with life stresses in ways related to the sacred, because every religion has their own guidelines in terms of talking about suffering, the cause of suffering, and the ways to overcome that suffering. It serves multiple functions: search for meaning, identity, intimacy, control. It is multimodal as well. It involves various behaviors, emotions, relationships. Every religion has its own guidelines about how you should conduct yourself, how you should behave, what you should do, what you should not do, and how God can actually intervene and help you transcend difficult situations. This was another patient of mine, and just a few days later, after this photograph was taken, she passed away. And she was also catastrophizing. And then we used religion to sort of convince her and sort of stabilize her so that she could come to terms with her own illness. This again depicts a good quality of life. This is our hospice basically, and We have retreat sessions for the senior citizens. They come over from Calcutta, and then this is how we sort of celebrate life, because life needs to be celebrated. Now here is another example of meaning making. Here it was not religion, here it was spirituality. In the previous example which I gave you, that was about religion, how religion helped that gentleman to cope, who had fought with his son, right? So his son came back and finally he could light his father's pyre. And this example is now about spirituality. And as you see, this lady, obviously you see she was very sick with a large ovarian tumor. She used to live in Tripura, Agartala. And this is her daughter. Her daughter was pregnant at that time. And this lady, she wanted to hold her granddaughter before she died. That was her wish. And that was her spirituality. That was a spiritual issue. And she traveled all the way from Tripura, which is in the northeast. She came all the way to Calcutta and started staying with her daughter until her daughter delivered this beautiful little girl. And the day this photograph was taken, the day her daughter came back from the hospital to home with her daughter, and this lady, you see the look on her face, the look of satisfaction as she held her granddaughter in her lap. A week later, she passed away peacefully. This was her spirituality. This had nothing to do with religion, you see, but this was her wish. This was her spiritual wish, that I should hold my granddaughter I should take my granddaughter in my arms before I finally die. So this was something very spiritual. Now, what are the behaviors that erode patient dignity? What are the behaviors from our part as, doctors or nurses or volunteers or healthcare providers, which make a patient lose their dignity? Relationships of inequality. Two patients, one VIP patient and another normal patient. If you're focusing more on the VIP patient, so-called VIP patient, then that would create a relationship of inequality. That is bad. Or to be treated like an object or without respect. Wishes not honored. This is a very important issue. Wishes not honored. And I had been to Shanti Avedna in Mumbai, and I was so impressed by one thing, that the patients, if the patients so desired in that hospice in Shanti Avedna Ashram, if they wanted to have a drink, a peg or two of whiskey, they were allowed to do so. People who wanted to smoke were allowed to smoke. And that was something very important, because the wishes were being honored. So the quality of life was being maintained. The dignity of a person was being maintained. Right? Now, how would you know that your patient is having spiritual suffering? So what are the signs or symptoms by which you would start suspecting that your patient perhaps has spiritual suffering? Pain, constant and chronic. You are giving all possible pain medications, but still your patient is saying, no, sir, I still am having pain. No, I cannot sleep at night. No, I am always crying. I don't like it. I don't want to live. So pain, constant, chronic, insomnia, cannot sleep, withdrawal, depression, sense of guilt, self-loathing. Oh, I am very bad. Basically, I am a very bad person. That is why God is punishing me. That sort of, feelings. Or having conflict. He's fighting with everybody, fighting with the family, fighting with the palliative team, fighting with friends. A sense of hopelessness. Oh, nothing can happen to me. I am doomed to die. That sort of sense. Lack of sense of humor. A sense of unforgivingness, despair, fear, dread. So these things, when you see in a person, you start thinking in terms of spiritual or religious suffering. Everybody, all of us have universal spiritual and existential needs, like the need for love. Everybody wants to be loved, you see. Need for love and authentic connection, the need to understand and transcend suffering. We need somebody who would understand us, who would be compassionate towards us, who would understand our suffering and who would address our suffering. It is not always that you go to a patient that you have to give some medicines or do anything. You can just go sit by the side of the patient, touch the patient if socially acceptable, or just sit quietly by the side of the patient, just to let the patient know that I'm here for you. You don't have to always say something very clever, right? You just have to make your presence felt. And that has to be a persistent presence, right? So the question comes is that will we die in a manner consistent with the way we lived, which respects our personal values, spiritual beliefs, cultural background, and preserves our dignity? Have now 43 participants are there in this lecture. How many of you have actually made plans for your dying? How many of you have actually saved some money for your death? How many of you have invested in your dying? Death is the only guarantee that you have. And how much investment have you done for your dying process? Zero. And all of you want to die a very peaceful death, isn't it? All of you want to die without suffering?
Yes.
Yes, great.
Yes.
Okay, sir. Yes, sir.
So, Sujata.
Yes, sir.
Very good. So if you have invested in your death, so that is the greatest investment which can happen. And this needs to be encouraged more, right? Because that is the only guarantee which we have in our life. The only guarantee which we have is our death. And we need to invest in our death. That is very important. Here, I basically practice in a rural setting, and we go down to villages, and there is a misconception that in villages you have joint society, joint families, and so many people to look after you. That was perhaps true till 25 to 30 years back. Things are changing very rapidly now. And this elderly couple, you see, this is the husband, this is the wife. The rest of the people, they are all neighbors. When our team came, they all came. Otherwise, nobody is going to come. Now, the husband, earlier, this is the wife. Wife had severe arthritis. She couldn't move. She can't get down without support. So the husband used to take the wife, hold the wife, and take her to the washroom. Washroom means there was an open shed somewhere. She used to relieve herself. But since the last 3 months, the husband gradually became totally blind. And now, the day we went to visit them, the husband was already totally blind. He couldn't see at all. And there was nobody now to take the wife to the washroom. And what she used to do was, she used to sit in this charpai. She used to just lift her sari and she used to relieve herself through the holes in the charpai. So it's not that the family system, the joint family system, definitely it had its own benefits, but then sadly so, even in rural settings nowadays, the whole system is being broken down, being eroded by so many factors. Let us not go into the factors. But the fact remains is that life is often very difficult, and especially for the elderly, and more so when you become an elderly person and then you lose your partner. That is the greatest loss which can happen to a person, losing your partner at an old age. So these are issues which are very prevalent, and these issues erode the quality of life. Now, what are the principles of spiritual care? Spirituality is an essential component of each person. As I said, this is something built in. This is not man-made. Religion is man-made. Spirituality is always built in. Spirituality is an ongoing issue. Readdress it over time. All of us have spiritual issues. Before, going to an exam, we'll have spiritual issues. Once the result of our exams are going to be declared, again, we will have so many spiritual or religious issues. We'll start praying to God. We'll start promising.
Sir, you're unmuted. Abhijit, sir.
Sorry. Now, is it okay?
Okay.
Yes, sir. Please go on.
Yeah. So what we need to do is to demonstrate respect for the patient's values, autonomy, and vulnerability. Do not impose your own ideas, especially about religion, to a person who is vulnerable. When does a person become vulnerable? When they are approaching death, when they are already suffering. This is when the person becomes vulnerable. So we should not impose our ideas. Rather, whatever his or her own issues are, that we should try to address on a spiritual plane and not necessarily or always on a religious plane, unless asked for. The most important thing is that we should know ourselves. Because if I am confused myself, if I am not at terms spiritually, if I am confused myself, then how can I do justice to others? You cannot pour out from an empty glass, can you? If your own glass is empty, how can you pour out water for others? So you need to fill up your own glass first with understanding. And about 15 years back, even I was an atheist, very strong atheist. And I didn't know anything about religion. And people, my patients, when they used to ask me religious questions regarding death and dying, I used to be stumped. So then I undertook, classes, I undertook certificate courses, special training in religion. I learned religion. And only when I could learn religion, then I started understanding myself. And once you understand yourself, that means you're filling up your own glass. And only then you can pour out for others. So, physician, heal thyself. You need to heal yourself. I took my own spiritual journeys, my own religious journeys, way up in the Himalayas, exploring various religions. So we all have inherent spiritual resources. If you say that, no, I really can't do it because I have no resources, then you're bluffing yourself. You're not bluffing others, you're bluffing yourself. Because we all have the capacity for love and authentic connection, to understand and transcend suffering of other people, to find a refuge or source of peace, and to find meaning in life. We all can do that. But for doing this, we need to come to terms with our own suffering first. We need to understand ourselves first. And this was a lady in the suburbs of Calcutta, where I used to go for palliative care. And this lady, whenever I used to get up to leave, she never used to let go of my hand. Because she had nobody to talk to. So it was not about treatment out here. It was all about healing. It was healing. And as I said, healing is imitatio Dei. Right? That is the imitation of God. This is the highest thing that you can do, healing. You don't have to be a doctor necessarily to heal. Any person who has a compassionate heart can do the process of healing. Here again, you see this young boy, he was dying, right, of terminal cancer. This photograph was taken way back in 2009. But you see in the background again, religion. Somewhere or the other, you will always find God hidden. So we always, whenever we are in distress, whenever we are in suffering, we either take recourse to religion or we take recourse to spirituality. Here again, this photograph again, this was a Muslim gentleman who had lung cancer. And just focus on the background. You see the calendar is written in Urdu out here. But then once if you take a close-up view again, He has some books on Hinduism as well. So religion loses its sharp edges as politicians or the society has made religion very sharp. The edges have become so sharp that we keep on hitting and damaging each other. But for a dying person, religion is something which brings about a sense of meaning or purpose in life. So it could be any religion. It could be any religion or a mixture of different religions. So as long as it restores a sense of meaning and purpose to one's life, that is the goal. Now I'll just briefly talk about each religion. And this is Adi Guru Shankaracharya in Hinduism. And in Hinduism, it is believed that we have repeated births from lower forms to higher forms. And Adi Guru had said that Jantunam Narajanma Durlabhmata, that amongst the so many births that human beings undergo, it is the human birth which is very precious. Why is the human birth so precious? Because humans are the only organisms which have intellect, the power to decide what is right and what is wrong. So that is why he said, Adi Guru said, that human birth is so precious. So make the best use of it. Do not waste the human birth. And in Hinduism, if you see the Bhagavad Gita and all, there various verses are and all given. I won't go into the details of this. I'm just trying to give you a glimpse of various religions. And if you see that most of these religions, they speak about the same thing. In Islam perspectives also, in illness seeks Allah's help with patience and prayer. Increase remembrance of Allah to obtain peace. Ask for tawbah. Give more in charity. Read or listen to the Quran. These are all written out there. So these few guidelines one has to keep in mind so as to guide the patient to the best of our own ability, if needed. See, similarly, in Christianity, sin and death are the predicaments from which we seek salvation. Our predicaments are ontological. The cure of this predicament cannot come through human power alone, and the power of God can help. Here again, that you need the power of God. Right? Now, there are downsides of religion as well. Right? There was a study which showed that high religious coping receiving more aggressive end-of-life care. So often this was one study which actually showed that. Here is another example. This was again taken in Calcutta a long time back. And this lady was actively dying actually. And then we brought in, these are our volunteers who started playing Rabindra Sangeet on the keyboard. They were playing music. And once the music began playing, this lady opened up her eyes and then she started smiling. And then actually she started singing along. So because music was very important to her, that was her spirituality. Because music gave her a sense of meaning and purpose to her suffering. It helped her transcend her suffering. So it could be anything. Spirituality doesn't have to be same as religion always. It could be anything. Here music was the key. So how do I do it? How do I actually tackle my patients? So first you have to recognize the suffering. Recognize that your patient is suffering, so with sympathy. You have to then respond with feelings of empathy and then be a compassionate presence. You have to show your compassion that how can I help to relieve the suffering of the patient? What can I do from my own side so that the suffering of that patient or of that family can be reduced? That is compassion. Your presence is awareness and kindness. Shift from doing to simply being. Right? Most important is authenticity. If you just sit there but you're thinking of something else and you're just looking at the watch, oh, 5 minutes over, now I have to go back home or this and that. The patient is very clever. The patient keeps looking at you, your face, with searching glances. Right? If the patient is not convinced, if the family is not convinced that you have come there with a good intention, because all of us, give out vibrations. We have our own vibratory zones. Many times you would also see a person and immediately you would not like that person and you'd say, no, I don't get good vibes by seeing that person. When we use the term vibes, these are vibrations. Everybody gives out certain vibrations. So your vibration should also be positive. And that can only be positive if you are mentally positive. Unless your mind is positive, unless you are focused positively on with a compassionate presence, you will not give out positive vibrations. Remain available and present. This is very important. You have to be available. Be available on the phone. Whenever they give a distress call, please respond to it. Right? Compassion is a very important key player in this. You have to develop the art of compassion. At our hospice, we do conduct retreat sessions on self-care to prevent burnout. So this we conduct on a regular basis. And as Eric Castle, he has said that bodies do not suffer, only persons do. So unfortunately, modern medicine treats the body. We treat the body. We are not treating the person within the body. The trick lies in treating the person within the body. Okay. Here you can see the fear in her eyes associated with the process of death and dying. I won't go into the details because I do a lot of work on dying, dreams, end of life dreams and visions. And actually I've done my PhD on that as well. And this is the fear of death and dying. And there are facts. It's a very interesting area, and I do work on afterlife also. What happens after death and how, and provided you believe it. And now science is also believing and has accepted the fact that even when your heart stops beating, the brain continues to function for some time, and so on and so forth. So it's an exciting avenue. There are so many issues which gradually come up. And religion, spirituality, they play a very important role in transcending this period of suffering, to make it more easy, to make the path smoother. This is one of my papers which was published way back in 2016. And again, I'll give you another example of spirituality. This was a little boy who, since his early childhood, used to frequent cancer hospitals. He had lymphoma. And ultimately, at this age of almost 6 years, 6 to 7 years of age, they declared him that untreatable, that he cannot be treated anymore. So since his very childhood, he used to spend all his time in a hospital. But he used to watch his other little children go to school. So he always wanted to go to school. So he expressed this wish for us that I want to go to school. So we talked to a local principal of a local nursery school, and she agreed. She said, okay, you can bring him in and he can spend some time in the school. And so we brought him this big watch. You see this huge watch which he has on his wrist. And then we brought him a tiffin box. He never used to eat otherwise. We brought him a tiffin box and a small bag with books, and he couldn't walk. So he used to sit on the wheelchair, and then we used to take him in a car to the school. He used to sit in the last bench in the nursery class. And then he used to sit and have his tiffin, and he used to draw beautiful pictures. But that little period, he could only go to attend classes for about a week or so. But that 1 week made a difference for him. Because in that 1 week, he could live his whole life. Because that was his spirituality. He wanted that school. He wanted to go to the school. Because he didn't want to consider himself inferior in any way to other children. This was one of the crayon paintings which he had made, which we still have it. And as Dame Cicely Saunders had said, that when you consider total pain, the spiritual aspect is also very important. Each part, the physical part of pain constitutes only 25%. Don't forget that. When you're treating pain physically with medications and all, you're just treating 25% of the pain. The rest 75% is made of social pain, psychological pain, and spiritual pain, which we sort of tend to ignore. These are very important. Focus on the 75. Forget about that 25%. Leave it to the doctors, 25%. You all can manage these 75% of the pain, can't you? You can do it. It doesn't require you to be a doctor. It requires you to have a compassionate heart. That's all it requires. And there is something called religious pain, which is feeling guilty over the violation of moral codes and values of his or her religious tradition. Like if you say that, oh, I'm going to have religion, like that gentleman, I gave you the example, no? That his son fought with him and went away. So he was thinking that if my son doesn't come and light my funeral pyre, then I will go to hell. So that was his religious pain, because that is what was sanctioned in his religion. Whereas spiritual pain is those who have concluded through their own self-judgment that there is something wrong with them at their core. If you think right from within that, no, I am basically a very bad person. So that is why I am suffering so much. So that is your spiritual pain. Okay. So this here was one more example. This elderly lady who had this huge tumors, and she had severe physical pain, which we treated. But even after treatment of her physical pain, she used to have a lot of depression. And then we finally found out that she had made a kitchen garden. She was always in a state of depression, you see. So this is the kitchen garden which she had planted. And there were a lot of vegetables in that kitchen garden. And every afternoon, she would sit in this charpoy facing the garden, and large number of monkeys used to come out there in the afternoons. So she used to sit with stones and throw the stones at the monkeys so that the monkeys would run away. Her main concern was that once I die, who is going to drive the monkeys away? Because for her, this little kitchen garden gave her a sense of meaning and purpose to her life. This kitchen garden was very important to her. That was her spirituality. So here, garden, that little garden, that vegetable garden was her spirituality. And then we asked her daughter-in-law to come and promise this lady that, okay, even after you die, don't worry, I will drive the monkeys away. And then finally she could die in peace. So this is another example of spiritual pain. And then finally there is hope, which is positive expectation for meaning attached to life events, right? So as long as there is meaning, there is hope. So we need to sustain hope. I'll end my talk here. And if there are any questions, I would be happy to take them.
Thank you, sir. Thank you so
Thank you,
much for
sir.
that wonderful presentation. Participants, if you have any doubts, please unmute yourself and ask, or you can use the chat books. It's your turn.
Nobody asking. Can I ask a question, sir?
Please.
See, regarding that locus of control, spirituality, and how healthcare look at locus of control. And you are speaking about external locus of control, and spirituality is external, like.
No, spirituality is very internal.
Is it?
Yes, spirituality which is inbuilt.
Inbuilt. Okay, then religiosity.
Religion is an
external.
external thing, which is
Okay.
because religion is man-made,
Okay.
which we have created.
Yeah.
Religion is something which is created by a group of like-minded individuals. That is
Okay.
that Whereas spirituality is something which all of us have within us.
Within us.
It can be expressed in various ways. For me,
Okay.
say, looking at my little child gives me a sense of pleasure. So that is my spirituality.
Spirituality.
Or, whichever way. So
Okay.
spirituality is inbuilt.
I think Dr. Nupur Nakasha has a question. Doctor, please. Doctor, please unmute yourself and talk. Dr. Nupur?
Okay, Dr. Nupur says that she is unable to unmute herself.
Please try again, Dr. Nupur.
So meanwhile, I will ask more questions, sir.
Yeah.
Nupur.
Hello.
Please, ma'am, please go on.
Yeah. Sir, I want to ask that, I'm also a doctor and I've
Mhm.
worked in India for more than a decade now in various fields, be it in government, corporate, village, NGOs, all various kind of experiences. I want to ask that there is such a huge deficit in spirituality in our field. How do we start addressing that? Because it's so difficult when you're the you're the only one out there understanding all these things, and around you you see such things happening and you're not able to express it, and it kind of leads to a kind of spiritual depression that nobody can understand, and you can't even express those feelings because there's no one who will address it also.
See what I gather from your end is that you definitely are practicing spiritual therapy for your patients, perhaps, but somewhere perhaps there is some vacuum within you as well. As I said that when we start exploring our spiritual issues, we need to start exploring from within also. And what is more important is that you don't have to prove yourself to others. There is no need whatsoever. What you need to do is just be focused on your patients, and your patients will be your best advocates, right? Even when I started on my own personal journey of palliative care, I used to be ridiculed, and I still am ridiculed in many amongst my colleagues. But that has never deterred me from my path. And I'm sure that if you stick to your path, you definitely would forge ahead, because what you have is the most important, is the most precious jewel, and that is your sense of compassion. That is a beauty, and you need to nurture that sense of compassion which you have and let it grow. You already are on the right path. Please go ahead.
Thank you, sir. Sir, but I just want to ask, because we are in this field and we ourselves are suffering spiritually as doctors or as in medical assistants, like we see our colleagues also suffering spiritually. So when we go to our patients, we see that conflict happening. So then how do we, it's kind of crazy,
No.
I hope you understand what I'm saying.
Yeah. As I said in the middle of this talk, we at our center, we do conduct sessions on retreat sessions on self-care. Basically what you're also going through is burnout. You have some degree of burnout, right? And it's absolutely perfectly normal to have burnout, because only those people will have burnout who work. So unless you work, you cannot have burnout. So you are definitely having some degree of burnout, which is quite common. And we need to take out time, and we need to take help, be it in form of retreat sessions, or if you want to consult your own personal, psychologists or something. Because burnout is something very real, which we need to address, so that to be kind to your own self. First, you have to be kind to your own self. And you need to ask yourself that do you really love yourself? Have you ever asked that question to yourself? Do you love yourself? And you will actually be very surprised with the type of answers you will get, So the basic idea lies in learning to love your own self. And because only if you can fill up your own glass with love, can you transmit that love to others. So that is where the whole game begins, learning to love your own self and then transmitting that love to others. So burnout is definitely something which I believe that you are going through, and it is perfectly normal. Even I've gone through burnout and I've come out of burnout, and that doesn't mean that I won't have burnout again. So this is an ongoing thing.
Thank you so much. Sir, I'm actually taking a break from my job because of the
Good.
burnout.
Excellent,
Thank you so
excellent.
much.
That's
It gives me a little bit of, peace after hearing you.
absolutely. Be kind to yourself. That is very important.
Sir, this is regarding, my question is regarding that multiculturalism and secularism in medical practice. And your this thing, spirituality, and how you combine all these things, how you practice a like secular way of practicing spirituality, medicine, and then healthcare like that.
See, what we need to, because when we talk of spirituality, spirituality is so very secular because it's got nothing to do with religion. And when you're addressing religion, being secular means that you're respecting every religion, you're respecting the beliefs of every person. That's fine. But then it is very difficult to be purely so-called secular. Why? Because you need to understand religion. Because the patient will keep on asking certain questions to you, which only that religious thing can answer. Their own religious beliefs can answer. So I am basically a Hindu. So I had to go back and read up the Upanishads and Vedanta and everything. I took a 1-year certification course in advanced Vedanta actually, before I could start answering the questions of my patients. So similarly, those who are in the Christian faith need to do that.
Yeah.
It should be a part of the medical curriculum.
Yeah.
Learning spirituality. It is important because our patients demand it, you see.
Yeah.
Here you are not doing it with a political motive.
You'll not be seeing a Hindu patient alone. No? You'll be seeing so many other religions.
Exactly. So so if you are seeing a Muslim patient, you can address their spiritual issues, and for the religious issues, you can take the help of a Muslim cleric. You have to take their help.
Yeah.
Right. So here you see again, it is not limited to a doctor. It is a teamwork.
Yeah.
So you have to take, the volunteers play an important role in this whole process.
As you were telling, you try to learn religion once you wanted to practice like that. Every doctor, every health professional should learn other religions rather than that, though they belong to that, and need to respect other religions also.
Absolutely, you're absolutely
that. Otherwise, we'll not be in tune with their feelings and emotions and their spirituality. And we cannot force our own way of thinking, our spirituality to other persons. So we have to be ethically neutral also.
Absolutely, 100% agreed with you.
Sir, we have 2 questions in the chat box. What is the spirituality of the person cannot be met due to physical health issue? Dr. Snigdha Ghosh.
Sorry, could you repeat the question?
What is the spirituality of the person cannot be met due to physical health issues?
Physical health issues, like even if you don't have a physical health issue, you could be catastrophizing about death. You could be thinking that will I be dying alone? Or you could be thinking that what will happen to my family after I die? Or you would be thinking about what will happen after I die. Will I go to heaven or hell? So there could be so many different types of questions which are not physical, which are not limited to your physical body, but which are related to your social body or your psychological body. So these are so many issues which have nothing to do with your physical presence. But all these issues will affect your physical body also. All these issues can increase your pain. All these issues can increase your sense of anorexia. all these issues can increase your vomiting, right? So all these issues, although they are not physical, but they can have a bearing on your physical health also. So everything is interrelated. After all, we are dealing with an individual. We are not breaking up the individual into different parts. Everything is interrelated. So when we are treating an individual, let us be very respectful in treating the individual as a whole that way.
Sir, another question from Archung Imchan. We are talking religion and spirituality as two different entities. But how about this? That my religion helps me in my spirituality or experience deeper spirituality.
Fine, agreed. All of you who are religious are also spiritual. That comes automatically. If you are religious, definitely you are spiritual also. But all of you who are spiritual will not necessarily be religious. You might not believe in God, you might be an atheist, you might not believe in religion, but that doesn't mean that you are not spiritual. Even a person who doesn't believe in God or any other religious process, he is also spiritual. So, but if you are religious, you are definitely spiritual. But if you are spiritual, doesn't mean that you are always religious.
Thank you, sir. Any other questions? Any other comments, doubts, anything else? Sir, there is one more from Akriti Manjo. I'm a psychology student, and although traditional healing practices are often shunned, through my internship experiences, I have always seen how traditional healing practices can be incorporated with scientific ways and how helpful it can be. So I could fully relate to this session. Thank you.
Excellent. I myself have started incorporating traditional healing practices in my in spite of being a allopathic doctor. But I went to, there is a place called Devipuram in near Visakhapatnam. I went there and I learned spiritual healing practices, which I use on my patients who are willing to undergo that. Because the power of the supreme power is unlimited. We can't even fathom what lies beyond. Science is just beginning to understand little bits and pieces of it, but there is a lot beyond. So we need to actually embrace all fields. Everything is, so holism, the whole concept is on holism.
Thank you, sir.
I think we should thank all the participants for participating in this program. And you should give your feedback also. How was the program as a whole? And before thanking Abhijith, Dr. Dam, I request all of you to give your feedback. And I thank Dr. Abhijith Dam for his very interactive and very thoughtful presentation on spirituality. It's really giving a insight to, I think that he is giving a good insight to all of us in our practice, our day-to-day practice. Thank you, sir. Thank you again.
Sorry, sir. There is one more question.
Sure.
Sir, I want to know that music therapy is the part of spiritual therapy.
Yeah.
That's a question from Neha.
Yes, definitely. And if you are a music, if you are very much into music, then you will. And if you are into ragas, into the various ragas, if you have an understanding of the ragas, then you will automatically have an understanding how important music therapy is in healing, right? And if you read up the Samaved, one of the Vedas is the Samaved, in which different types of music, different ragas have been prescribed for different mood disorders and different disease processes as well. So there's a huge, that's again a huge unexplored area. So you can explore that.
Thank you, sir. I think there are no more doubts. We could wind up the session. Thank you, sir, for being here with us. Looking forward to have many more sessions with you again for many other cohorts. Thank you so much. And thank you all of you. Indeed, this is our last session of Foundation course in palliative care. I think you all had a better time with us. Thank you for being with us. Thank you so much. Thank you once again and bye. I have shared the feedback link with you. Please go through it. If you have anything to ask us or anything to add on, please contact. Please don't hesitate to contact us. That WhatsApp group will be there for our use. Thank you so much.
Thank you.